Hi, my name is Sophia Scott, and I am the Texas Account Manager with Reality Works. Today, I want to share some innovative ways that you can engage your health science students. We offer task trainers, simulators, and soft skills training for many health science pathways, including CNA, EMT, patient care tech, medical assisting, sports medicine, and nursing. A little bit about Reality Works before we get started. Our products are developed with hands-on learning in mind, from our real care baby and total parenting experience to our welding, agriculture, and health science programs. We help teachers create lasting educational and experiential learning experiences. Reality Works takes into consideration the needs of educators. We go to conferences around the country and listen to educators just like you. This is where we get inspiration for new product ideas. When we develop new products, we start with the standards-based curriculum, then design a simulator to bring that curriculum to life. We then add activities and assessment pieces, resulting in a fun, comprehensive experience to develop career skills. We also have a team of professionals that can assist you in every step of the way, from account managers such as myself that can assist you with product selection and purchasing, to a fantastic product support team to assist you after you purchase products with any questions. So in this session, I'm going to go over why experiential learning resonates with today's learners, simulators that we offer to teach technical skills, as well as wearable simulators to teach soft skills and develop patient empathy. I'm going to share some ideas on DIY wearable simulators that you can create yourself, along with best practices for using simulation. Along the way, I'm going to share lots of free resources, including Reality Works curricula and online resources that are provided by other sources. Times are changing, and this generation of students is different in how they learn and view the world. They are tech savvy and have shorter attention spans. They're used to tweets and instant messaging and are known to read less than 20% of traditional text. They prefer active hands-on learning. They want to be successful, but they will disengage from learning if they don't see the relevance. They connect more easily with teachers as facilitators. The most effective teachers will be doing tasks right alongside the students and showing them that it's okay to make mistakes. So how do we teach this generation? We need to modify what we do. Provide them with more than a textbook. Videos, online activities, group work, and models work well with this group. Use a variety to keep their attention and give them an experience. Be flexible in your teaching methods and the way you communicate with your students. Simulation technology is well documented as a teaching methodology in health science education. Here is just one quote from many of the studies that you can find. With COVID, there's an even greater need for hands-on learning in the classroom. We've had a lot of interest in our products to help provide hands-on simulation, skills training, scenario-based learning, and soft skill development to supplement students not being able to participate in clinical rotations. Simulation creates authentic scenarios and replicates the complexity and unpredictability of real-world situations. This will challenge students to use critical thinking. Simulation is flexible and offers the opportunity to introduce, reinforce, and assess key concepts. It facilitates success and helps students gain confidence through learning and repeated practice. It also engages students and excites them with a new form of instruction. Here's an example of how a CNA program can look like in your classroom with our CNA pathway package. We also offer pathway packages for geriatric, basic nursing, EMT, and medical assisting. Of course, everything is available separately, and we can customize packages to meet your program needs and budget. Before we begin with the next section on resources, I want to share this access site with you. We've made all of our curricula and product guides available as a free resource for every product that we have. We've made this available to teachers during COVID to help provide resources. The screenshot on the right shows where to access health science resources at that link. To get curricula on a specific skill or topic, click in your area of interest. So for example, if you click on skills trainers, you will get a drop-down menu. And from there, you can click on phlebotomy and find the curriculum that goes along with that product. So you can incorporate these resources even if you don't have our products. With our curriculum, you will find the PowerPoint slides, instructions, handouts, and assessment tools. I'm going to highlight a few free resources that you can find in our plethora of available curricula to help teach health science skills. At the end of the presentation, I will share a link to a landing page of all the links provided today so you can have easy access and not worry about writing all the links down. So now let's take a look at some simulators for teaching technical skills. Our auscultation trainer is our newest award-winning product. It teaches students correct stethoscope placement as well as how to accurately recognize heart, lung, and bowel sounds. There are 3 components that make practice scenarios realistic and customizable. It includes the torso with the removable skin, the reality scope, which is attached to the end of your standard stethoscope, and then the tablet with the software and the app. Here's a 1-minute video.
The realistic auscultation trainer can be used to teach students correct stethoscope placement as well as how to accurately recognize heart, lung, and bowel sounds. The included tablet features an app programmed with 21 sounds and over 40 scenarios, enabling instructors to make practice and assessment both realistic and customizable. The reality scope connects to any stethoscope to let students hear heart, lung, and bowel sounds when placed over a corresponding auscultation site. For added realism, each sound is an actual recording engineered to sound correct through the stethoscope. Sounds play only when students move the reality scope over a precise auscultation site and apply the correct pressure. Visit our website or talk to your sales rep today to learn more about this innovative product.
Next, we have our blood pressure simulator. This is a one-of-a-kind training tool and is also an award-winning product. Here's a short demonstration.
This is the blood pressure simulator that we've developed here at RealityWorks. The device is intended to teach proper blood pressure measurement techniques for students in the classroom or healthcare simulation settings. We've created it to be different from other simulators on the market to provide a more realistic and engaging experience for the students. Included is a pulse wristband for measuring the radial blood pressure, a standard adult cuff that does not inflate as to not cut off circulation in the students, as well as a comprehensive user interface that generates random practice scenarios as well as 10 programmable testing scenarios. This cuff can be used on a student, mannequin, or the standard patient in a healthcare simulation setting. Although the cuff does not actually inflate, so that a student can wear this for a full class period and not have to worry about circulation The practice scenarios allow the student to visualize low blood pressure, high blood pressure, or a normal blood pressure. The screen depicts the pressure within the cuff. That's also on the analog gauge, as well as the release rate, showing a too low, too high, or correct release rate. The next screen shows your blood pressure answer, heart rate, as well as your average release rate. The RealityWorks blood pressure simulator is certainly one of a kind, and we are proud to have developed it in-house. You can go to the website to learn more and contact our sales team for a quote.
Another feature that teachers love about this product that wasn't mentioned in the video is that you can use a speaker to work with a group of students. Even if you don't have our blood pressure simulator, you can use our blood pressure simulator curriculum. It is available via the link that I just shared. One activity you could do is to take the steps and the procedures and type them into a Word document, scrambling the order. Then challenge students with putting them into the correct order. In Google Docs, you could set this up so that each step has a correct number associated with it, and it could be auto-graded. Some other free resources available, not through RealityWorks, but online, is an online self-test that includes audio files as well as knowledge questions with an answer key. There are also audio recordings of Korsakoff sounds students can listen to. We have a new ECG trainer that has quickly become an educator favorite. One of the reasons that we developed this product is because teachers were telling us that students felt insecure when practicing lead placement on each other. This simulator is made of pliable materials so students can palpate to place leads in correct location. It provides immediate feedback so students can correct mistakes immediately. They will also be exposed to a wide variety of rhythm readings. This simulator helps students prepare for domains 2 and 3 of the certified EKG exam. Here's a quick video with to give you a demonstration.
Hi, I'm here to talk to you about RealityWorks award-winning ECG simulator. We saw a need in the market for a hands-on simulator to help students with lead placement and accurately reading rhythms. This simulator can be used in common classes like EMT, paramedic, and nursing. So what all comes with the simulator? We have the ECG simulator. We have a cord that will run from the simulator to a tablet. The simulator will come with 3 lead, 4 lead, 5 lead, and 12 lead ECG electrode sets. We'll also supply the actual electrode pads as well. It will come with 20 student workbooks, a basic ECG rhythm flashcard set that includes the actual rhythm and with the interpretation written on the back. It will include a storage case, a 1-year limited warranty, and access to our online curriculum. Let's talk about the curriculum that's included with the ECG simulator. The ECG simulator comes with a curriculum that is about 2 to 3 hours and includes presentation slides, student activities, as well as pre and post assessments. The curriculum contains basic EKG placement, measurement of ECG strips, as well as atrial arrhythmias, ventricular arrhythmias, and conduction block arrhythmias. The students are using the lessons for foundational knowledge. Then they're going to use the workbooks to apply knowledge that they have learned, use flashcards to identify rhythms, and then using the simulator in practice and assessment modes. The great thing about the practice is that they will get feedback, and the great thing about assessment is that they can test their knowledge. Now I'll show you how to do a 5-lead ECG. First, you'll want to select the practice mode on the tablet and select the 5-lead ECG. On the tablet is the anatomical model showing where the electrodes should be placed. Take the pads and place them according to the diagram. So in 5 lead, there is the right and left upper extremity. The right and left lower extremity. And for the purpose of the demonstration, I'm going to place them here. And then V1, which is the 4th intercostal space down. And on the right sternal border. You take your 5 lead electrodes, plug them into the simulator. And a helpful hint if you are having the mannequin lie on a table is to spread these out. So to untangle the electrodes. Like I said, I always start with white on the right. And these are also labeled with like RA for right arm, LL left leg. And one saying that I sometimes use with students is that clouds, the white clouds go over green grass, black smoke over red fire, and chocolate is close to your heart. So if you set it up correctly, then the tablet should look like this. Note that all the areas are in green and you're given the choice between sequential and random rhythms. You can go and click and the rhythms will appear for practice. It should be also noted that there is a red and green light on the simulator that will also guide you in placement as well. If one of the electrodes is not placed correctly, it will be red. If they are all placed correctly, it will be green. If you have any questions or would like to receive additional information,
However, if you don't have our trainer, you can have access to our curriculum where you will find PowerPoints and lessons that teach these same concepts. Here is a 3-page ECG interpretation handout in our curriculum that goes along with the lesson on this topic. There are lecture notes and a slide presentation you can access and then deploy this as a written activity. An answer key is provided for you as well. Here are some free resources that we found online. This is a free guide to 12 lead ECG placement that you can find on the internet. And here are 2 online ECG quiz sources that we found: a self-grading rhythm interpretation quiz and a video. We also have suture kits available. This handout is from our suturing kit curriculum. It is important to integrate vocabulary development into lessons so that students understand and can speak the language of the occupation. This is an easy way to introduce core language arts skills into lessons. This 2-page handout is from our suture kit curriculum. There's also a slide presentation that goes along with this information. The vocabulary sheet information could be turned into flashcards for students to use for practice. Quizlet is just one online flashcard creation website. The link here is for a free suture flashcard set that's already been created inside Quizlet. The next activity comes from the curricula from our multi-purpose Venus training arm. It is found under skills trainers and then multi-purpose arm and then introduction to phlebotomy. In our lesson plan template, each lesson starts with a focus activity, which is a brief activity to engage students and set the stage. Here is an anatomy activity that can be used as an introduction to phlebotomy. Here, students learn about the veins used in phlebotomy and answer some key questions. There's also a short video that could be paired with this activity on phlebotomy veins. Here are a few resources that we found that you could use to supplement the lesson content on phlebotomy, or at least bring some of the written content to life. There are lots of videos, and you'd have to preview to know which are of high quality, but some are quite good. There are also animated anatomical tutorials all about veins. Here's one link, for example. You can find free phlebotomy apps as well. Here's one called Phlebotomy Technician. If you look for phlebotomy simulation providers, this is one that popped up, and they have a free 1-week trial. It is $9.50 per month to subscribe and consists of a 12-module phlebotomy course. You can also use free apps. For example, there's one called Mega Blood Draw Simulator, and I'm not speaking to the effectiveness of these resources, but you could check them out as potential options. Next, we'll share some free resources available when using our medical mannequins. At Reality Works, we offer an adult nursing mannequin, a PD mannequin, a geriatric mannequin, and a closed fracture trauma mannequin. To access multiple lesson plans that go along with our adult nursing mannequin, go to our curriculum link, click on mannequins, then adult nursing mannequin curricula. All of our mannequins come with multiple lesson plans. Each lesson has soft skills integrated, like patient communication, as well as technical skills. Here's one lesson that comes along with our adult nursing mannequin on intramuscular injections. With medical mannequins, you can practice many different procedures. This is a very robust scenario guide for 3 scenarios: ambulation, wound care, and IV insertion, that can be role played with an adult mannequin. If you have a bandaging and wound care mannequin like the one above, it provides a lot of hands-on practice in class. However, if you don't, here's one activity you can take from the curriculum of our bandaging and wound care mannequin. It is a dry, sterile dressing check-off list. You can prepare the lecture using our PowerPoint and notes in the lessons. Then students can practice on each other with dry, sterile dressing. There are many videos that specifically address bandaging for medical assistants or even EMTs. Here are just a couple. We offer a diabetes education kit for teaching the impact of diabetes on body parts. This is an example of a handout that can be found in the curriculum that comes with this kit. The activity you see here is an introductory handout that helps students learn about key anatomical terms. You could make it available to students. Then if you have an anatomical model like this, you could do a live demo covering the anatomical parts of the foot. You also have access to a robust PowerPoint and lecture regarding diabetic foot ulcers. You can give students this assessment procedure and have them practice with someone at home. There are many short videos that you could post to pair with the assessment checkoff for more information. So you can see how using an anatomical model can lead to a whole series of activities or related lessons. Now let's switch gears and talk about wearable simulation. We all know intuitively the benefits of wearable simulation. Nothing helps students learn patient empathy and understanding more than walking in the shoes of someone with that condition. Students can learn important patient communication skills through wearable simulators. We recently had a research study completed showcasing the benefits of a wearable geriatric simulator. Allen College Assistant Professor Stephen Bowen studied the effect of geriatric simulation scenarios on his graduate occupational therapy students. When you're asking an elderly person with arthritis to open a jar, you need to think a little bit differently, said Bowen, who has been teaching for 5 years. It's good for students to get a realistic perspective before they go into practice so that they can better understand what they'll be dealing with. Bowen used Reality Works Geriatric Simulator and our Geriatric Sensory Impairment Kit to identify how the use of age simulation gear during daily activities changed students' empathy toward aging adults. Here's what he learned. Aging simulation seems to improve empathy toward the aging population. Geriatric simulation can promote understanding of targeted populations. Geriatric simulation exercises can help students understand both potential struggles and benefits of aging. With increased sensitivity comes improved care. Here's a snapshot of some wearables that we offer to teach empathy. These simulators are great to give students an understanding of what it's like to have a condition or live with it on a daily basis. Nothing will create a more memorable, impactful experience like walking in the shoes of someone who is experiencing some of these conditions. Here's a closer look at our award-winning geriatric simulator.
The RealityWorks Geriatric Simulator is used to help students gain an understanding and empathy towards the elderly. This is a wearable suit paired with comprehensive curriculum used in courses for health occupations, nursing training, human growth and development, family and consumer sciences, and more. The included curriculum is a 13-hour standard-based curriculum used to help facilitate discussions on aging and the elderly. It also has suggested student activities to do while wearing the suit that involve daily tasks like walking up the stairs or opening a pill bottle. The parts and pieces with the suit show physical effects of aging, such as loss of mobility, stooped posture, fatigue, and joint stiffness. It also comes with a set of 6 visual impairment glasses, including common eye ailments like glaucoma and cataracts. Contact your account manager today for more information on the Geriatric Simulator and other RealityWorks learning tools.
But if you don't have these simulators, I'm going to share some ideas we have for creating some low-cost DIY wearable simulators. To simulate a visual impairment, you can wear glasses smeared with soap or Vaseline to simulate cataracts, wear glasses made with the wrong prescription, or wear sunglasses indoor to simulate macular degeneration or glaucoma. You can use sleep masks for total blindness. You could take clear safety glasses and buy window cling material on Amazon in a dark color. You can cut out a hole in the middle for glaucoma, or you can just put a dark circle in the middle of the glasses for macular degeneration. Here are some ideas for arthritis, specifically the hands and feet. Taping together the thumbs and forefinger of the dominant hand and binding 3 fingers on the other hand restrict movement and fine motor skills. Popcorn kernels placed in socks and shoes simulate the foot pain associated with poor circulation, neuropathy, and arthritis. If you put hands in gloves filled with unpopped popcorn kernels and have students do some tasks, it will dull their fingers' ability to feel, also simulating arthritis. Loss of tactile sensation and numbness in the extremities due to aging is very common. To simulate this in the hands, you can try different types of gloves. Wearing several pairs of thick gloves while writing, tying a shoe, or buttoning a shirt to simulate, or wearing thinner gloves while filling pill bottles can simulate impairments like numbness or neuropathy. Wrist and hand braces can be used for loss of dexterity and restricted range of motion. To simulate hearing loss, you can easily use earplugs or noise-canceling headphones. Tinnitus could be simulated by simply playing a sustained high-pitched noise of some sort. There are also tinnitus simulation audio tracks available on YouTube. Hearing loss over time could be simulated by gradually by turning down the volume of a device using music or the sound of voices. To simulate conditions like COPD and emphysema, you could do the following. Have students breathe through a straw as long as they can. This is actually harder than it sounds. Or get compression garment or a binder to enable the wearer to physically experience COPD's typical strenuous, labored, shallow upper chest breathing only, as well as the subsequent fatigue, irritability, and emotional distress that inevitably results from the sensation of not being able to get enough air. You can find these compression binders online, and use of Velcro can help accommodate many sizes. To create an aging simulation experience, you could gather a series of things from Walmart or even budget online sources. By using ankle weights and wrist weights, ACE bandages, back braces, weight training vests, along with interacting with canes and walkers, these things together can simulate mobility challenges like fatigue, loss of strength, and restricted range of motion. Even osteoporosis and astute posture from wearing a weight training vest can be simulated. Ankle weights can help simulate a shuffled gait as seen in some elderly people. For mobility challenges, you can incorporate canes, walkers, wheelchairs, crutches, and splints. Hemiparesis is weakness on half of the body, while hemiplegia refers to paralysis that affects just one side. Because paralysis is an extreme form of weakness and nerve dysfunction, hemiplegia is an extreme form of hemiparesis. To simulate this paralysis on one side, you can use a series of braces and bandages on one side of the body to make it difficult to do daily tasks and ambulate, simulating stroke or other related causes of this condition. While we offer a pregnancy simulator, here are a few do-it-yourself projects you can try. First, take a backpack and begin to fill it with a total of 25 to 30 pounds. The goal is to fill up the space in the backpack representing average weight gain by the third trimester. Then have the participant wear it backwards so they can feel the difference in their center of gravity. Or you can simply take something such as a warm water, like a hot water bottle or a beach ball partially filled up, and wrap it around a baby wrap or a sling and wear it low on the abdomen. You could also use a medicine ball that has some weight to it and have students try to put their shoes on, pick up things off the floor, sit and stand, etc. We know that wearables give students a chance to walk in the shoes and to gain empathy and understanding. But there's another line of wearable simulators that also teaches specific nursing-related hard skills. I'm going to share some wearable simulators that we have for teaching nursing skills. We've already discussed our blood pressure simulator, and here are some other options. Small injection pad that has an adjustable hook and loop strap to make it wearable. An IV administration trainer allows students to practice IV fluid administration and flushing and is great for one-on-one student practice. Our venous venipuncture and IV administration trainer allows users to practice basic venipuncture and IV administration skills on a patient. It has a realistic vein system as well as lifelike blood flashback. Our forearm venipuncture trainer class pack teaches proper venipuncture procedures with realistic vein puncture and blood flashback. The class pack includes 5 trainers and is ideal for a class working on venipuncture training. All of these are great resources to teach technical skills while developing patient communication skills. We even have some moulage kits that can go on students as a wearable or a mannequin from which to create many scenarios involving skin assessment, documentation, and treatment. Shown on this slide are our trauma moulage kit, our industrial burns kit, our pressure injury simulation kit, our geriatric skin condition kit, and our pediatric skin condition kit. All of these kits include curriculum as well. Now I'll share a few best practices for using wearables in your program. Here are some tips. Encourage group interactions whenever possible so students can build off of each other's experiences. Using stations is a good way to implement a variety of experiences to rotate through. It also makes classroom management easier with less wait time for students. Consider assigning students a specific role at each station, like that of the patient and that of the healthcare worker, so they have the chance to experience the conditions and then experience helping someone with the condition. Some other tips are to provide opportunities for reflection after each experience. Do this as a large group, small group, or even in pairs. Journaling exercises are really good. You can provide key questions for students to answer about their experience. You can provide a pre and post reflection activity. Here are a few good questions for at the end of the experience. Make sure to facilitate reflection on individual performance. How did it go? How did you feel during this experience? How will this change your future interactions with your patients? So I've shared some resources on wearables for teaching nursing skills, as well as teaching empathy and communication skills. But now I want to share some other free resources that we have on our website. Here are some additional resources available to you. First of all, we have an ongoing series of webinars that are free. You register at this link. Once you register, you will get a copy of the recording and handouts via email the following day of the webinar, regardless if you were able to attend. So if you see something that interests you, you can go ahead and register. And even if you can't attend, you will receive all the information the following morning. There are dozens of archived webinars on our website that you have access to as well. RealityWorks also wants to connect with you through social media as well. Visit our blog for additional information from customers, like us on Facebook, and follow us on Twitter and Instagram to learn even more about our products and industry happenings. I'm happy to assist you in any way I can. I'm available to answer questions, discuss program needs, create quotes, provide product demonstrations, and we even have alignments for our health science program to Perkins 5 funding. As promised, here is the landing page to access the free resources linked in the presentation that I shared with you today. And here's my contact information and our website. So please reach out if you'd like more information. That's all that I have for you today. I appreciate your time, and I hope that each of you took away some ideas that you can incorporate in your health science programs. Thanks, and have a great day.